Bulimia Nervosa. As far as my patient goes, he is Chad. He's a 22-year-old accounting major on his last semester of graduation before he enters the workforce. He also plays for his university team. He's on the football team. And as of right now, he is going through the recruiting process to hopefully join a firm after graduating. For Chad's family, he lives with both his mom and his dad. That's Barbara, mother, and father, John, and he lives with his sister, Jamie, who is 27 years old. For their family history, his family has always considered themselves to be very close. Chad and his father, John, have both shared a love for football. They love bonding and watching football. His mom was a cheerleader for most of her life until she graduated college, and Chad's sister is a swimmer. The entire family has considered themselves to be very healthy, very athletic, and they prioritize their physical looks. John, which is Chad's father, has always prioritized the thinness and body image within the family. This is kind of where that prioritization of health comes from. He does have a history of steroid abuse and body dissatisfaction. He has a short temper when it comes to sports and eating habits. He kind of has very strict ideas when it comes to performance in sports and what dieting should look like. As far as Jamie, she was previously diagnosed with anorexia nervosa and suffers from body dissatisfaction as well. Chad's symptoms that I wanted to mention: he is an outgoing and popular student in college. He's very known for being a star football player, and aside from that, just being very fit, very lean, muscular. He's also very fearful of gaining any body fat. He follows a strict diet when he's around other people, doesn't have any cheat meals, doesn't eat any fast foods. He does see himself as bigger than he would want to be, and he's continuously trying to look more muscular. That's his idea of a great body, would be just to be more muscular. He often fasts for days on end, and this is part of his dieting that he likes to do. Chad has been feeling very stressed and anxious, so during these times he has found himself excessively eating foods that he otherwise would stay away from on diets or dieting. These stress-induced bingings last around an hour to 2 hours, and they happen about 5 to 7 times a week. After eating large amounts of food, he does kind of feel guilty and disgusted, and this will cause him to vomit. And as of recently, due to not being able to expel these foods through vomiting, he has found himself starting to abuse laxatives to maintain his weight. For the DSM-5 criteria of bulimia nervosa, the first one is reoccurrent episodes of binge eating that are characterized by eating within a 2-hour period an amount of food that is definitively larger than what most would eat in a similar time period within the same circumstances. And secondly would be a feeding that one cannot stop eating or control what or how much they're eating. The second criteria would be reoccurrent inappropriate compensatory behaviors to prevent weight gain. So this would be vomiting, misuse of laxatives, diuretics, or other medication. Also includes fasting or excessive exercising. The third criteria is binge eating and inappropriate compensatory behaviors occur on average at least once a week for 3 months. The fourth, self-evaluation, is unjustifiably influenced by body shape and weight. Fifth one is the disturbance does not occur exclusively during episodes of anorexia nervosa. For remission, partial remission would be after the full criteria were previously met, but not all criteria have been met during a sustained period of time. And then full remission would be after full criteria were previously met and none have been sustained for a period of time. For biological risk factors, the main one I wanted to point out was a family history of eating disorder. About 56% of inherited biological factors contribute to developing an eating disorder. So Chad's father, he has a history of body dissatisfaction, which I've previously mentioned. He also has a history of steroid abuse. And then Chad's sister, Jamie, she was diagnosed with anorexia nervosa back in college, but she has fully recovered through therapy. Environmental risk factors of bulimia nervosa. The first one is personal experiences of trauma. So, usually, people with eating disorders have experienced past trauma. This can be sexual, emotional, or physical. As far as Chad goes, due to John's bad temper and emphasis on thinness and dieting, Chad's been emotionally and verbally abused by his father regarding his weight and physical performance. The second risk factor is sports. So, sports adds risk due to the endurance and the weight category aesthetic, and can even extend into sports clothing. So, just kind of revealing sports clothing and competitive thinness. Chad has played competitive sports. He's been playing football from an early age, and he's very conscious of his performance on the field. He always strives to be better in football. Lastly, the last environmental factor is teasing and weight criticism. Weight-related teasing and critical weight comments, often by parents, have been identified as risk factors. Chad's father repeatedly makes comments about Chad gaining weight, maintaining his weight, and watching what he's eating. Psychological risk factors that I wanted to point out are stress. Bulimia can be triggered by stress or transitional periods, and for Chad, we do see him going from college to the workforce, so this is a huge transitional period for him, and he has found himself a lot more stressed out due to the interviewing and just kind of recruiting process for a possible job in the future. The second one is perfectionism. This is one of the strongest psychological risk factors that includes setting unrealistic expectations for oneself. Chad's always been known for being a good football player, and he feels the need that he needs to maintain this performance in football, as well as maintaining a reputation of having a good physique. He's very known for being very fit, and he wants to maintain this reputation. Lastly, body dissatisfaction, so disliking appearance and high levels of insecurities about physical appearance. We don't see Chad to be insecure. He doesn't say he's insecure, but he always feels like he can be more muscular and lose more body fat. So the assessment for bulimia nervosa is the eating disorder examination. This examination is not just for bulimia nervosa, but all eating disorders. So this is a semi-structured interview that reflects the DSM-5 criterias for bulimia nervosa. There are 4 subscales to this examination. So the first one's dietary restrictions. Second one would be eating concerns. Third is weight, or 4 shape concerns. This assessment is measured for somebody's 4 weeks. So the latest 4 weeks are 28 days of their life, of their current life. Scores for the assessment range from 0 to 6. 0 is not present of any eating disorders, or 6 is present to an extreme amount. So as far as Chad's score on the assessment or examination, he did score a 5. He expressed eating disorders present about 5 days a week, indicating present, but not as severe for a 6 score on the assessment. He's also displaying some anxiety, which we've mentioned before. Chad's family was made aware of his examination, and Chad's dad, John, did deny his presence of an eating disorder, but his mother and sister did notice this obsessive pattern of strict eating, as well as kind of dismissals to the bathroom pretty often. Some comorbidities that lie with eating disorders or bulimia nervosa is major depression, followed by generalized anxiety, as well as obsessive compulsive disorder, social phobia, and panic disorder. For Chad, he has been experiencing some anxiety, as we said, but He doesn't meet the full criteria to be diagnosed with general anxiety disorder. The medical comorbidity that we see for bulimia nervosa is electrolyte disturbance. This can cause fatigue, confusion, irritability, muscle cramping. Chad doesn't really display, he does display an electrolyte disturbance, meaning some of these symptoms such as fatigue, irritability, or muscle cramping. Lastly, weight loss and deficiency anemias. We don't see that Chad is losing a significant amount of weight. If anything, he's just maintaining the same weight. And we don't see that he's displaying any deficiencies for anemias. As far as treatment for bulimia nervosa, some biological ones would be selective serotonin reuptake inhibitors. This is just an increase of serotonin in the brain, and it contributes to weight gain, but it's often used more for those comorbidities that we just said, such as depression and anxiety or obsessional thinking. The second medication that I wanted to talk about was antipsychotic medication. This is a medication that works by blocking dopamine receptors in the brain, helping control these binge episodes. But this antipsychotic medication is often used for binge eating, just not bulimia nervosa. Going into psychological treatment, cognitive behavior therapy, which is one of the most famous. This therapy reduces distorted thoughts and poor behaviors. This has a 50% effectiveness for patients with eating disorders, with 1 to 3 of them in remission, 1 of 3 of them in remission. The second is interpersonal psychotherapy. This focuses on improving or helping interpersonal problems. And while this is as effective as cognitive behavior therapy, it does have a slower time course. So that's why it's not used as much. Lastly, family-based therapy. This therapy can be used, this therapy is also known as Maudsley method, and this aims to bring support and safe environments for patients through the help of families, and this has a 95% confidence on remission rate. As far as Chad's treatment, he has started cognitive behavior therapy. He meets with a therapist for 1 hour every week, and the sessions will be from 6 to 20 sessions or until symptoms seem to improve. Cognitive behavior therapy is going to be in 3 different phases for him. The first is psychoeducation on weights and effective binge eating and extreme dieting in order to recognize better eating patterns. The second phase of this therapy is to reduce weight concerns and reduce dieting and purging behaviors. Third phase and last phase is to maintain a better eating pattern and prevent relapse. Chad also is going to attend family-based therapy along with the cognitive behavior therapy. This is going to be with the same therapist, also once a week for about 20 sessions. This will focus on support for a healthy eating habit and breaking down strict dieting. This would be in general for the family, as we do see that strict dieting plays a big role within the family. And then due to stress and anxiety, we have placed Chad on a low dose, which would be 50 milligrams daily of SSRI inhibitor, an SSRI, which would be fluoxetine. For patient results, after 10 sessions, we did see Chad has entered a partial remission. He only meets the C criteria, which is an inappropriate compensatory behavior to prevent weight gain. He is doing this by excessively exercising, so we're still working on the inappropriate compensatory behaviors of preventing weight gain. As far as that, there are no other criteria that are being met. Chad's family has become a lot more flexible with their dieting. They're not as strict with what they're eating. Chad also doesn't feel as anxious or stressed anymore as we previously had seen from him. He has received multiple job offers, so that may be the reason why he does feel a lot better mentally. And then looking back after 20 sessions, we do see Chad enter into a full remission. He's even gained 5 pounds, and he still is visiting with his therapist once a month. And that is my case study on bulimia nervosa. Here are my references. Thank you.